and the social determinants of health within the healthcare system, and seeing how that influenced healthcare. And so that was my focus in ethnic studies. And by majoring in ethnic studies, I was able to study abroad in Barbados. So that was a very interesting, the most famous person from Barbados is Rihanna. So I was able to see where Rihanna grew up and also see her mansion. It's really big. It's right by the beach. And technically anyone could go to her beach because all the beaches in Barbados are open to the public. So technically anyone could go to Rihanna's beach, but we didn't. But doing that, I just felt like I was able to get a better sense of what healthcare can be worldwide. Barbados is in the West Indies, and it's actually one of the leaders in the West Indies. A lot of the neighboring islands go to Barbados in order for HIV treatment and any rapid HIV test. That's what Barbados is actually like the station to spearhead any HIV treatment within the West Indies. So it was interesting to be in another and experience that. I also took the biopsychosocial challenges of HIV and AIDS to complement just my ethnic studies, and I really appreciated my time there and felt like I was able to give a little bit of what I offered to the community there, and learned a lot from the Barbadian or Bayesian culture there. I am a first generation to attend medical school. I'm the first in my family to attend medical school. So as you can imagine, it's applying to medical school is such a hard path. Like there's just different ways. There's like studying for MCATs, all the prereqs, and it's just a very daunting path. So that's why it's very important to find mentors and programs like Mi Mentor, to find your community and to build that network so that you can look at different programs that you feel you can benefit from and also partake in. So what's unique about my medical school is that it's a 1+3 model, where 1 year I'm going to be just in Arizona, and for the last 3 years, you're placed at a community health center spanning from Hawaii all the way to Brooklyn, New York. And luckily I was placed here in San Isidro, back in California, which is south of San Diego. And I'm loving my time here in San Isidro, and I'll get to a little bit why I chose to apply to my school a little bit later. But before medical school, I did have time. So backtrack a little bit more. It took 5 years for me to graduate. I am a Gates Scholar. So I was able to use my funding for the Gates Millennium Scholarship to graduate in 5 years. I didn't feel like I was ready to graduate in 4 years. So I took that extra year to take more upper division science courses, and also the semester to study abroad in Barbados. Again, this was pre-COVID, so I don't know how that's going to affect everyone trying to study abroad now after COVID. And then after applying, or after graduating from undergrad, I took 5 hustle years. I don't call them gap years because that's kind of a misnomer, because you're not doing, it's a gap of nothing. You're hustling to get into medical school or into any health profession school. So you're hustling with MCAT studying, you're hustling taking post-bac courses, you're hustling working in community health centers, you're just hustling. You're just trying to get the experience so that you can show like medical schools that you are an amazing person. So don't call them gap years, call them hustle years, because you're hardworking and you're just recognize that you're doing what you can in order to be in places that no one has in your family or your community has gone before. So just continue doing amazing things in your community. So in those hustle years, right when I graduated, I started to feel a little bit of burnt out, because Berkeley and any college is hard after taking hard sciences. And plus I just needed to kind of recalibrate and needed to see where my path was taking me. So the summer right after graduating, I did an internship with the Health Careers Connections, and they placed me at the California Primary Care Association. And at the California Primary Care Association, it's the state association that represents all the community health centers throughout the state of California at the legislative level and federally. And I was able to network with CEOs of different community health centers throughout the state of California, and also chief medical officers. And it was amazing just to be in that room, just to see what the possibility is and see the intersection of and the founders of these community health centers that grew up in the 1960s. So that was my connection to CPCA, was that I was able to see the people that were fighting for healthcare rights in the 1960s are now CEOs and running big organizations now in their age and trying to make a difference within the healthcare system. So that was my tie and how I was able to use my ethnic studies to advocate for healthcare at a state level with the California Primary Care Association. And since CPCA works with all the other associations throughout the nation, they comprise a network called the National Association of Community Health Centers. And NAC actually was the organization that started to fund or try to look for places to start a medical school in Arizona that partner with community health centers. So through CPCA, I learned about my school and about a unique opportunity called the Hometown Scholars Program. So if you work for a federally qualified health center, have experience at a federally qualified health center or at a community association like CPCA, you could get nominated. And our school looks at applicants very seriously and pretty much grants interviews or just or you have a higher chance of getting an interview to our school because you know what it means to work at a community health center or the needs that are associated with community health centers. So after my time with CPCA, I met with my mentors and needed to figure out what my next steps was because I was still pre-med. I still wanted to go into medical school. And so I took a hard look at my grades and decided to do a post-bac. So I did a do-it-yourself post-bac at my local Sac State, so a local institution, four-year university, because like anything, you still need letters of recommendation from science professors. And if you go to big institutions like Berkeley or any other big institutions, it's really hard to have a good relationship with science professors. So I needed to take a little bit of extra time to develop that relationship, build up my science GPA, and still work with the community by volunteering at my local community health center in Sacramento with their behavioral health team. And I'm just fallen in love with community health, especially at community health centers, and see how, again, the grassroots organizations is important to build trust with the community and outreaching efforts. So I was within my role at the community health center, I was able to do HIV or facilitate rapid HIV tests at the consulate in Sacramento just to educate the community on safe sex practices and if they were ever feeling that they were at risk of acquiring HIV in Sacramento. And then after my time after volunteering and taking post-bac courses, that's at the time that I started becoming involved with Mi Mentor, and because I was missing that community action. Yes, I was building professionally, but I needed more of my peers, and that's where Mi Mentor came in to help me build that network of peers and people that were struggling like me to help each other out so that we can be change agents within the healthcare system. So my most important experience has been Mi Mentor, the California Primary Care Association, to build me up professionally, and my time with One Community Health, because eventually that volunteer position turned into a part-time job that helped pay for my applications to medical school and MCAT because it's expensive applying to medical school. So research, for me, I did most of my research through summer internships and different summer programs. So throughout my undergraduate time, I did 3 summer internships, one at UCSF with an OB-GYN concentration. And the research that I did was more academic. The following year, I did do a public health summer internship at Columbia University, and that was amazing. It was my first time going out of state in New York. The whole summer in New York was really inspiring just to learn from a different Latino community. in California, we're used to see like a predominantly Mexican community or Central American, but in New York, it's more of the Caribbean Latinx community. So I was able to hear more about their experiences immigrating from the Caribbean, like the Cubanos, the Puerto Ricanos, the Dominicans, and addressing the needs of the elderly population, because I was in a senior center. Facilitating a fall prevention program. And I really was inspired by them. And again, that community aspect, I want to become involved in the community. And after all that, I decided to apply to medical school and was ultimately accepted to my school and was matched to come here to San Isidro. So my final message would just be, just find your why and your passion. You don't have to be a science major to go into medicine. I was certainly not a science major, but I feel like it does add a little bit extra because you will be a little bit more unique in your applications. When you interview at places, you'll have more content in terms of why you're interested in being that change agent for your community. And for me, like, ethnic studies has a lot to do with advocacy, and it helped me craft my advocacy skills at the policy level in the state legislature, but now just advocating for for my patients, more for what they need at the community health center. And so for me, I'm still very fired up to work in underserved community. That's why I'm here in San Isidro. And in the cohort, the 12 people that are here with me, I'm the only one that speaks in Spanish. So I'm a very high commodity right here in San Isidro. And I feel like I'm able to connect with the patients a lot more because of that language element. And anything that I can do to help inspire you all to pursue, because we need you. We need you all in not only in medical school, but in PA school. If you're interested in mental health, there's a huge need in mental health right now with COVID. Oh my goodness, there's a lot of things coming down the line with COVID, with mental health. So we need you in any way, in fashion or form, and you all are valid in your stories, and continue being amazing in what you want to do. And we're just here to help inspire you, and hopefully you could take a little bit of nuggets. But if you have any questions, I can take any questions, but if not, I could do more questions afterwards at the end.
So I have a question. So can you kind of elaborate on kind of why exactly you picked osteopathic medicine over just the MD?
Yeah.
And maybe kind of explain a little bit of the differences, some things that you get to do as a with your osteopathic medicine.
Yeah, definitely. So what's a little bit unique about osteopathic medicine, you're still doing your boards studies. So like most of us in osteopathy take two boards. So we take the USMLE and COMLEX, because COMLEX is what we need to be in order to be certified in osteopathy. So, and we can prescribe medicines, we could be surgeons, we could be pretty much anything that we want to be, like MD, what's regular. But what's the added bonus I feel with osteopathy is that you can use your hands a lot more to diagnose and treat patients with chronic back pain, with any headaches, with anything. Before we touch opioids or anything like that, we're going to first try to deal with their pain and address them by looking at what we call somatic dysfunction, which is the low back pain, and diagnosing and inherently restore motion back to what the patient has, because you're restricted with back pain. So you're like sitting down, crunched over, and what we're trying to do is to loosen up the muscles in that area, and hopefully they get some relief for a couple of weeks, and then they could come back for another set of treatment before we touch opioids. And what osteopathy, I feel like it's an added benefit, because you can do that simple fix, and people are, I haven't treated anyone in my clinic, but whenever I go back home, people with headaches, like my family relatives and family members, they kind of go up in line, and I do a simple fixture and everything, and the night they sleep like a baby, like say, oh, then I haven't slept in over like a week, and after doing whatever you did to my neck, I felt like I was able to sleep comfortably for the first time. So finding that instant relief is really beneficial, and I hope to add that a little bit more within my practice at a community health center. Luckily, here in San Isidro, both of my regional directors of medical education, they're both osteopathic physicians, and one of them has really cultivated their skills and implements their osteopathic principles within their practice, and they're really able to benefit and add relief to patients instantly within the medical visit. And for me, what also called my attention is I'm for community health centers, and being placed at a community health center really called on my attention, and I could definitely see the change that I'm making. My presence alone here is adding diversity not only to the class, but also I'm able to reach patients that my peers are not able to reach. And then I do see a question. I was wondering, how do you go to class if everyone is scattered at the FQHCs? Yes, I can definitely answer that question. So each FQHCs or community health centers has a dedicated class. So right now, our dedicated classroom is in San Isidro, is in the main headquarters. And luckily here in San Isidro, you have 24-hour access to the building, which is nice. And there's conference rooms. So if you need to have a little bit more of a discrete conversation or discrete like study sessions, you can take one of the conference rooms here at the main headquarters. And what's unique about our school, everything is online. So Zoom University, our school has done it. So the transition to Zoom wasn't really that hard for our school, because our school was already doing pre-recorded lectures, and so that transition wasn't too hard for our school overall, because our professors are used to recording sessions and uploading it to a central place where you can look at your outline or the material that you need to do for the week. So hopefully that answers your question.
Okay, thank you very much. If anyone has any other additional questions, you can wait till the very end and you can ask it as well.
Great.
Next, we're going to let Alexis go ahead and talk about his journey.
So, hi everyone. My name is Alexis. I am in the MPH. I'm in Prime. I'm a fourth-year Prime student, currently on my MPH year. So, although I'm at UCSF, I'm in this program called Prime, Program in Medical Education. It's a 5-year dual degree program that is supposed to train physicians to become physician leaders in medically underserved communities. Every UC medical school has them except for Riverside, and each of them focus on a different thing. So the one at UCSF is focused on urban underserved, and as a requirement, you're required to do a master's in between your third and fourth year. So that's where I'm at right now in my path. I barely started my fourth year, and then I took a year leave of absence to do my MPH here at Harvard. So that's kind of where I'm coming at. I am originally from the Sacramento Valley, so in this small town called Grimes, California, about an hour north of Sacramento. And for undergrad, I went to UCLA, and I majored in Chicana and Chicano studies with a minor in public health. And so before I get into kind of why I majored in that, I want to talk a little bit more about my background, because I think it informs it. So like I said, I'm from a small town in Northern California. There's only about 300 people in this town, and the majority are undocumented, at least growing up, are undocumented migrant farm workers who would come in and out of the town with the changing of the seasons. And that, I think, informed a lot of my experiences growing up, because as you can imagine, in this small town of 300 people, there was no clinics. Not very many people had a means of transportation. The nearest clinic was maybe 25, half an hour away. But even if you could get to the clinic, you still had the barrier of access to care. Like, it costs too much for people. If you're, a migrant farm worker, you're not going to get insurance through your company or through the farmer. So you'd come out of pocket. So that was another barrier. And then even if you could pay, even if you can get there you still had this issue of language where the physicians didn't speak Spanish. Some of the staff did, which was good, but you know, some of my earlier memories with the doctor as a kid is translating. As somebody who had frequent ear infections, had to get a tonsillectomy and some tubes in my ears because I had frequent ear infections and stuff like that. That was something that really stuck with me, is that I needed to translate for my parents. And as a kid, I wasn't really all that great at Spanish, but it's all that there was, right? Was me translating. And so that inevitably led to like some issues with medications and such. But I'm sure that kind of brings home the point of that, like, if you didn't have a physician who spoke the language, there's going to be consequences. If you don't have the ability to get to a clinic, there's going to be consequences. If you can't afford the care, there's going to be consequences. And I think in my childhood, some of the more I should say it's like the more striking points of my childhood was seeing the consequences of those things. And so I decided when I went to UCLA that I wanted to be a doctor. And so I kind of explored that a little bit during my first couple of quarters there, and I joined some organizations. So I joined most notably Chicano Latinos for Community Medicine. It's an organization that was basically a support system for Latino pre-med students at UCLA, but also, you know, did community outreach and volunteer work where we put on quarterly health fairs in Los Angeles and in Tecate, Mexico. So it was a good way for me to both explore whether medicine was something that I wanted to do, stay connected to my community, as well as gain mentorship from the upperclassmen and the different physicians that were involved with the organization or who had gone through before. So that was a really good opportunity for me. But like it says up here on the slide, I'm first generation, you know, college student, first generation pursuing a career in medicine. But I do have an older brother who took the path before me. He went to UC Berkeley. He graduated, went to UC Irvine for his medical school, and now he's a practicing physician. So I was fortunate enough that I had that mentorship early on. So I knew that I didn't need to be a science major to get to where I needed to go. And he was, I think, a psych major, right? So he wasn't a hard science major. So I think I came in with the opportunity to know that I should use my major as an opportunity to explore something I'm interested in. And really the reason I chose Chicano Studies was because I wanted to explore my own identity. Coming from this small town, a lot of my, you know, that area of California, although it's California, is pretty conservative. And I think throughout the 18 years that I lived there, there was maybe some internalized kind of things racism that I had in myself. And so I wanted to explore what my own identity was. At this point, I was pretty interested in health disparities and kind of things that were going on in my community. So I wanted to, you know, study medicine with that kind of critical lens. So I majored in Chicano Studies, and I really discovered a lot about my own identity. We talk about in Chicano Studies, I took a lot of history classes, and it wasn't until I actually took history of Chicanos that I discovered things about my own family. It gave me kind of like the language to ask about things that happened in Mexico. Like, for example, I learned about the Bracero program, which was a program in which Mexicans were brought from Mexico to the United States to work during World War II, during the 1940s and 50s, and I think it ended in the 60s. And I learned that my grandpa was a bracero, and the reason that we kind of landed in this small random town in California was because that's where they took him when he became a bracero. He became close with a lot of the farmers in that area, and so once the bracero program ended, he started to come as an undocumented undocumented immigrant to continue to work in these fields, setting irrigation in the northern Sacramento Valley. So when his sons were old enough, that's where they came with him as well. And so, you know, when it was time to start a family, my dad didn't see any opportunities in Mexico. And so he brought us to the only other place he knew, which was Grimes, California. And I would have never known that without Chicano studies. And I wouldn't have known that history of my people, had I not, you know, decided to study Chicano studies. And in addition, I think it's important that I also minored in public health, because it gave a context to the health outcomes that we see now in our communities. Studying the history, politics, literature of, you know, Chicano scholars is great, but being able to then translate that into how it may have impacted our health, and giving us more context as to where we are now, I think was really powerful for me to contextualize as an undergraduate going into applying in medical school. So I took 4.5 years to graduate, and that last kind of semester, I did a kind of a one-class postbac while I was working part-time. I mostly did a lot of community work with like Chicanos Advocates for Community Medicine, as well as for Mi Mentor. I did a lot of mentorship work with Mi Mentor early on, and as well as with the Venice Family Clinic, which is an FQHC in West LA. I didn't really do a whole lot of research, which I think might be surprising to some folks. I never published, and I really only did some history research looking at the Chicano health movement of the 1960s, and I only did that for maybe like a couple months. So research was never really heavy for me in undergrad, but I think what made me stand out as an applicant was my my story, and I think I want to go back a little bit to talk about that. So I told you all a little bit about kind of how I grew up and the issues that I saw. And when I went into undergrad, I really wanted to explore that a little more, about the disparities that I saw, my history, kind of my own the health disparities that exist in my community, right? And that's the kind of lens that I took with everything that I did in undergrad, including my major. And I think that's what made me a strong applicant, was that there's a very clear idea of what I was interested in, and I was able to build a common thread throughout my application, down to my, you know, major, personal statement. Even my letter writers knew this about me and knew what I was committed to. And so I think in being able to kind of show the admissions committees where my interests were and where I would fit into their school, that ultimately ended up making me a better applicant. I do want to talk about the strength of being a non-science major. I mean, I talked a little bit about, and so did Adan, about the fact that you get to study something that nobody else in your class probably studied, right? So you're bringing that kind of critical lens into your class, and that, you know, is only for the betterment of everybody around you. But I think there's also strength in being a non-science major, because it gives you, at least in my case, it gives me some context as to the health that I see in my community. The weaknesses, I think, is that you do have to take kind of basically classes that don't count for anything else, right? When I was taking my Chicano 101 class, that didn't count for any science classes that I needed to take for med school. And just because I'm not sure where everybody is in their path to medical school, you have to take, I had it pulled up here. You have to take 1 year of chemistry. Let me see here. Yeah, so you have to take 1 year of biology with lab. You have to take 1 year of general chemistry with lab. You have to take 1 year of organic chemistry with lab, a course of biochemistry, a year of mathematics, a year of physics with lab, and then they recommend like a psych class. So none of that was in Chicano studies, right? So I basically needed a double major without actually getting a double major, and that was challenging. One of the strengths, though, was that I could take one science class and then two Chicano studies classes, or like a Chicano studies class and a GE class. knowing that I really only needed to focus heavily on my science class, make sure I get an A or however, really trying to focus and get an A in that class. And my Chicano studies classes, I can finesse it a little bit. So that was, I think, another strength in that it gives you kind of a small reprieve in between your science classes without having to need to pack it in. The downside to that is that if you're only taking the requirements for your science classes, then that's all you got. You know, if you're a science major, you have more upper class, more you know, classes after your prereqs that you can take and try to bump your science GPA. But if you don't major in science, it's harder to do that. And you know, you can take classes afterwards and extension and stuff like that. But the weight of each of the classes feels a little heavier, you know. But you have more time to focus on it. So it's really, I think, in terms, if you're thinking about it just in terms of like your application to medical school, there's a double-edged sword there, right? Which I think is an important thing to note. Overall, though, I think if I had not majored in Chicano studies, I probably wouldn't have been as successful in trying to matriculate to medical school. Had I tried to, you know, be a sci-fi major or a bio major or something, I feel like I really would have missed out on the opportunity to connect with the other side of campus. I would have missed the opportunity to understand myself more. I think I would have missed the opportunity to understand my future patients more. So ultimately, I'm totally happy with my decision to major in Chicano studies and minor in public health. I think I got to all the important points that I wanted to talk about. I'm happy to answer questions.
Yeah, we have one question in the chat asking whether if you did take all your post-bac classes in one quarter.
Yeah, well, I only took one class. It was like human physiology or something like that. So it was like a 5 or 6 unit class. So it was pretty, you know, it was pretty hefty, but it was the only class I was taking with working part-time at the Center for the Study of Latino Health and Culture over at UCLA. So that's how I made it work. And really I took it just because I think one school that I was applying to required a like anatomy type class. I'm not exactly sure, but it was also nice because I was like right at the cusp of like a 3.4 or something like that. So I was like, oh, if I can take one more class, I can like get to that nice round number, and hopefully that would like improve my application. You know, how were you able to take extra classes if you had already finished your major requirements? I spread it out, so I didn't finish my major requirements until the very end. So it was a lot of like working with my department counselor to try to figure out exactly how I can like space out my classes. So it was a lot of like pulling up a 4-year plan and like drawing it out and figuring out how many units I could take and what do I need to do during this summer, what can I do, what other classes can I take. I did end up taking maybe 1 or 2 classes that I didn't need to take. I ended up taking like maybe 1 or 2 science classes also that I didn't need for requirements, but I just wanted to take because it was going to be helpful for applying. And that's how I finessed it. It was a lot of like, what was really great about my department counselor was that she didn't know how to help me because there's not very many people at UCLA who majored in Chicano studies and were like pre-med. There's maybe 3 of us. And so she was like, I can't really help you with the med stuff, but what I can do is like, you sign up for all your science classes first, and I'll make sure you get the classes that you need to graduate. Like that was our deal, you know? So, and that was like super, super helpful for me. And so that's how I was able to kind of finesse it, where I was able to take some classes throughout my my 4.5 years and not have too many science classes all at once. I think there was another question here. Did your non-science background make the transition to medical school harder, or medicine harder, since other science students may have had some background in medical classes? Yes. there were some people in my class who had like a PhD in biochem. And so, you know, I took one semester. I was clearly behind there. There are some people who had like PhDs in genetics. There was people who were, you know, phi-sci majors and already learned all the anatomy. And so it was review for them. Yeah, but they're learning something they already kind of know, whereas I was learning something new. And so I think they missed out in their undergrad learning something new. But yes, they were ahead and made it easier for them, sure. But they're not going to know everything. You know, they might be prepared for the basic sciences in the first year or two, but a lot of medicine isn't that. So just because they're more prepared for the science majors or for the science classes doesn't necessarily mean they're better prepared to be a medical student or a physician.
Okay, thank you. I think that's a great question. We can put it at the end. Oh, we have one more. Said, did UCSF pay for your Harvard Master's in Public Health? Why did you choose to do your Master's in Public Health at Harvard? And how is your time so far?
So as part of the Prime program, there is a stipend to complete your Master's. It doesn't have to be at Harvard, but once you complete your Master's, they give you a $20,000 grant that's kind of applied to your fourth year. So when I come back, I'll get the grant and it'll help pay for my last year of med school, which is really nice. Why did I choose Harvard? So I applied to two schools. I applied to UC Berkeley, MPH, and Harvard. Through UCSF, we kind of have a guaranteed admissions to Berkeley, which is really nice. And it's also one of the best schools in the country. So, and as somebody who wants to practice in California, I thought going to Berkeley would be an excellent opportunity to learn from the kind of experts in California public health. And so that was really attractive. And so the only other school that I would attend was Harvard. And the only reason I attended, not the only reason, but the biggest reason why I decided to come here instead of Berkeley was that it was far cheaper for me to come here because Harvard paid for my tuition. So all I'm paying is for living expenses. Whereas Berkeley, the best that they could do as a public institution was give me in-state tuition. So it would have ended up being about $30,000 more to go to Berkeley, which is unfortunate. But you know, I think here at Harvard there's other opportunities that being a Harvard student kind of opens for you, which is kind of nice. I also think it's the first opportunity that I've had to live outside of California, which I think is a very valuable opportunity. And I think another thing is that my classmates are all kind of from all over the world, which brings in really interesting perspectives. There's people who can comment on the work they've done with the Canadian healthcare system or the Taiwanese healthcare system. You know, there's somebody in one of my classmates who's like was one of the, I forget exactly how she said it, but she was very, very involved with implementing like the Taiwanese healthcare system. And so it's really incredible the kind of experiences that people are coming in to this MPH with. Another quick thing, because I know I've been talking for a long time, but I'm doing specifically health management, and at Berkeley it was health management and policy together. So it was a little more focused over at Harvard's MPH.
Okay, thank you. We're going to go ahead and move on to Mohamed.
Hello, everybody. Again, thank you so much again, Alma, for giving me the opportunity to be part of this, and it's been very nice getting to hear about the story of Dan as well as Alexis, their path towards to medical school. My name is Mohamed Jawara. I am a second year physician assistant student at the Betty Iron Moore School of Nursing here at UC Davis. But before I get into my background and my undergraduate career, I just want to discuss a little bit about the physician assistant profession because not a whole lot of people knows about it, what it's about, and what we do. So a little bit of history. The PA program came into existence in the mid 1960s when there was a shortage, started to have shortages of primary healthcare professionals, primary healthcare physicians. So the first class was started in Duke University in 1965. It was a class of 4 students that were military corpsmen who during World War II had received a lot of medical training to provide care for individuals wounded in battle. However, being that they didn't have a license, once they got out of the war, they were not able to practice as physicians. So the PA program was established to help individuals with a lot of medical background to make them recognize them as a profession so they can bridge that gap of the shortages of healthcare professionals in the United States. The first class graduated in 1967, and by 1970, the PA profession had gained nationwide recognition here in the United States. So what is a PA? So physician assistants are medical professionals who diagnose illnesses, they develop and manage treatment plans, they prescribe medications, and they often serve as well as a patient's principal healthcare provider. What can PAs do? It depends on the specific duties, the amount of experience that the physician has, as well as which states that they are in, because each state has certain laws that physician assistants have to abide by. But generally, physician assistants can take medical histories, physical exams, diagnose and treat illnesses, order and interpret tests, develop treatment plans, just as mentioned before, prescribe medication, and even assist in surgery, and make rounds in hospitals and nursing homes, as well as do clinical research. And where do PAs work? There are more than 140,000 PAs who practice in every medical setting that you could possibly think of in the whole of United States, including the District of Columbia. They work in hospitals, in medical offices, in community health centers, in nursing homes, retail clinics, as well as correctional facility institutions. And according to the U.S. Bureau of Labor and Statistics, the physician assistant program is projected to increase by 31% as far as profession, job opportunities in the future. So it's a pretty good field to start off with. So that's just a little bit of a background of the physician assistant profession. Now a little bit about my undergraduate career. But before I get into that, I just want to discuss a little bit about my background as a person, where I came from, which in the end is going to inform why I decided to choose the majors that I did during my undergraduate career. I'm originally from Sierra Leone, West Africa. It's a very small, tiny country in Africa. And I actually grew up there for about 12 years before immigrating here to the United States with my mother. And during the time of me being there was civil unrest, there was civil war, and having to grow there, I got to see firsthand the inefficiencies of government, and I got to see, as a result of those inefficiencies and mismanagement of the country's resources, the government was unable to provide basic services for its population. Services such as good education, running water, electricity, and above all, healthcare. So growing up, I got to see, as a result of those inefficiencies in having strong healthcare institutions, it was common to see friends and family members die from diseases that have been eradicated here in the United States. Diseases such as malaria, or diseases like the common cold that you should not be dying for, but we had people that were dying from that. So having had the opportunity to immigrate to the United States, and in 2014, getting into college for the first time, I started wrapping my head around, what can I major in? What can I do that will give me the skill set that I will not only be able to utilize them here in the United States, but I could also utilize them at some point in my life back home. So that's how I came about deciding to do a double major in political science and law and society. And then I considered a minor, but it's not technically a minor, but just pre-medicine. So I realized I have a passion for both, politics as well as medicine. And so I decided to pursue both. An incident that even solidified my decision to choose both careers, both degrees, was the Ebola outbreak virus in Sierra Leone. Again, it only exacerbated, it only reinforced my mentality that as a result of the core inefficiencies in government, the virus was able to spread more, and more people lost their lives unnecessarily that they needed to. So that again just reinforced my decision to major in both degrees. Now, being a first generation student, my mother, my dad only had a high school, diploma. It was definitely very difficult initially for me to navigate undergraduate college system as a whole. So I relied heavily on mentors that I'd had the opportunity to interact with during my high school career, and as well as people that I met in my college. And while I was in college, I was involved with a program called the Health Profession Advising Center, which basically helped me, being that I was non-science major, helped to make sure that, just how Alexis was saying earlier, to make sure that I do get those science classes that I do need to get either to medical school or PA school or any healthcare profession. In addition to that program, I also met with my college advisor regularly, my political science advisor regularly, to ensure that I'm still completing my political science courses, and while I'm pursuing, medical school classes. And one of the things that my advisor asked me to do was, because again, just like how Alexis has said, we didn't have a lot of students that were majoring in politics and wanted to go into the medical field. So I had to sign a contract that stated that I cannot get below 3.0 in any of my classes. I had to pass all my science classes, otherwise I would not be able to pursue that science track. And luckily enough, I was able to graduate within 4 years with both the degree in political science, law and society, as well as a minor in pre-medicine. While I was in college, I also worked as a certified nursing assistant. As I will discuss a little bit later, to get into PA school, you need about 1,000 hours minimum or so of direct patient care. So I was able to get my patient care by being a certified nursing assistant in skilled nursing facilities. And I also volunteered in a local emergency department, which helped me to be able to get those hours in while I'm also in college. So that was my experience as an undergrad. So during my senior year of college, I decided to apply my first time around. Oh wait, I think you went a little bit before. It's a little bit back. There we go. I decided to apply to PA school, and applied to about 13 different PA programs, and all 13 rejected me with no interview whatsoever. And I knew 13 was not a lucky number, but I went for it anyhow. But that did not discourage me. I was like, okay, so what am I doing wrong? All rejected me, no interview whatsoever. So I started looking at my applications and reviewing what I've done and see what I can do to bolster it, so that the next time around that I do apply, I will be a little bit of a success. And one thing during my analysis that I realized was that I didn't do too well in some of my science courses, surprise, surprise. one of them being chemistry and another one in biology. So I decided during my gap year to enroll in a local community college where I was able to retake those classes, got a way much better grade. And also, during that time, I was able to like take other, classes like nutrition that some other PA programs were requesting and others were not, just to make sure that I'm a full, well-rounded candidate. In addition to applying again to community college after graduating from university, I interned as a public health at the Riverside Public Health Department, county department. And you may think, okay, so that's not medical related, it's public health. Why wouldn't you just get more hours as a CNA? Again, just like how Alexis was saying, and Dan alluded to a little bit, was just trying to like make myself a unique candidate. So I decided to intern in the Department of Public Health. While I was there, I was able to actually learn about the social, the economical, cultural aspects of determinants that contributes to an individual's health. Those factors that are way much more so heavier than even the common disease processes. So that internship opportunity gave me that outlook about health. In addition to doing that, I also was fortunate to work at a community-based research center. And basically what this center does was it actually goes into the community. So the community that I had the opportunity to work with was heavily African-American and Latinx community. It goes into the community and then it asks them, what health factors are affecting you that you would like for us to take a look at to collaborate with the city government to ensure that we're reducing it so that you can have a better quality of life. And one of the projects that I had the great opportunity of working on was trying to determine some of the factors that leads to asthma exacerbations in the community. And we found during the research that communities that are, Latinx community and African-American communities, they tend to see more freight, commercial trucks coming into the communities, and they tend to see more warehouses coming into the communities, which in turn pretty much turns the air quality very poor. And, individuals are, breathing in this poor air quality. It's exacerbating their asthma, and it's leading them to have worse outcomes. So as part of the project, we're able to work with local city officials and work with the community that are being affected to find a solution whereby we're not having so much pollution into these communities, and in turn, decreasing the amount of asthma-related causes, and as a bigger picture, saving the city money as a result of, not having more emergency visits of people coming in because of asthma. And while I was doing all of that, I also was, tackling that's like, a dance, word, hustling, because it is a hustle, trying to like juggle everything, at once. It's not easy, but just wanted to like have as much experience as possible. And, while having that experience, also applying to graduate school. So I give it a second try again, this time around, very strategic, applied to some PA programs, applied to some public health programs, because I had, gotten, sense of public health. I was like, oh, okay, this is a great field to explore. I got accepted into public health and PA school, but at the end of the day, I decided to choose PA school for now. And then maybe in the end, if the opportunity were to open up, to also pursue public health, because the two go hand in hand. And after I got accepted to UC Davis, I just decided to travel a little bit. I had the opportunity to, travel to about 8 countries or so in Europe, and just got to like experience that culture a little bit. So that's pretty much what I did during my gap year. And I'm just going to go talk a little bit about the program requirements for PA school. Each school is different. I'm mostly going to focus on UC Davis. So I highly recommend, if there's anyone in the group right now that is interested in being a PA, to highly do your research to make sure that you're meeting the requirements that each school is asking for. As far as UC Davis, you need a bachelor's degree. It could be in anything. I have some friends in the program currently that majored in arts, others were photographers, and I'm in political science, and we're doing great so far. You need a minimum GPA of 3.0 overall, a minimum of 2.7 in all of your science courses. And as I said earlier, you need about 1,000 hours of either paid or volunteered hours, patient experience. And also there's a centralized application called CASPA that you go through to apply. And the beauty of CASPA is that with one application, you can apply to a lot of PA programs, throughout the country. So through there, you're able to like put in your personal statements, your statement of purpose, submit it, and then the school reviews it. They see you're a good candidate, they call you in for an interview. If they think you're a good candidate after that, they ask you to do a secondary application. And with that, they'll ask for letters of recommendations. This could be from a professor, supervisor that you worked with, or any doctors or individuals you had the chance to shadow. And then you need to like send in, of course, official transcripts to the school itself, to CASPA and the school once you've been accepted. Now, UC Davis does not require students to shadow physicians or physician assistants to get into the program. Other schools do. Also, UC Davis does not require the GRE or the MCAT. So again, that's one thing I loved about UC Davis. Like they try to like minimize all these barriers that are there to like get obstacles to prevent individuals from certain backgrounds from getting into these institutions. So again, I think that's the reason why they decide not to do the GRE and the MCAT. But some schools do require it. As far as prerequisites, of course, in human anatomy and with lab, of course, in physiology with lab, you could do it both together. A course in chemistry with lab, a course in microbiology with lab, English composition, and then 2 social science courses. So being able to just have those prerequisites and meeting those program requirements, that's all UC Davis asks for. And that's basically what some other schools ask for as well, but I would highly recommend to do your research to make sure that you're meeting those particular requirements. So what has the PA experience, what has it been so far? So my program, it's a 27 months program. Other schools are 3 years, but in general, like PA schools are like 2 years to 3 years. Mine just falls in the middle. The first year is all didactic, where you just learn, again, the anatomy, the physiology, the pathophysiology of medicine. And during my first year, I had the opportunity to actually work in one of the student-run clinics here at UC Davis called Imani Clinic. And it's located mostly in a predominantly African-American Latinx community. And we're able to provide free healthcare for individuals that are in the community, and also, send them to pharmacies that we know that will provide cheaper drugs if they need that medication, as well as direct them to places where they'll be able to get their labs for free. So we get to see migrant workers and just people in the community that do not have insurance. That's what I did my first year. That second year, which I am in now, I get the opportunity to do my clinical rotations, which is, I get to rotate between different specialties, surgery, primary care, OBGYN. I just started, so currently I'm doing primary care, and it's been great so far getting to see a whole lot of different cases, disease processes coming in. So that's to meet my 2,000 hours requirement for clinical. In addition, the program is a full-time program. Again, think about it. It's like medical school crunched into 27 months. So it's it's very, very, very intense. So as a result, the program recommends that people do not work while they are in school, but some people still find a way to do it. I don't know how to do it. I need to figure that out so that I can make some little cash in the end, but they do it. The program requires you how to do it. So yes, so it's a master's program, and being a master's program, in addition to the clinical classes, you also have to take elective classes to sharpen your research skills and, your community-based, interaction skills. And last but not least, in order to graduate from the program, you need to pass a comprehensive exam to show that you've mastered, like the materials from the didactic year, as well as, clinical rotations. And after you're all done with that, after you graduate, you could then go ahead and take the board exam, which is the ANSWER exam. And then, you certified to become a physician assistant, and you can work in any of the 50 states and the US territories as well. So I just want to talk a little bit about, what it's like being a non-science major, being in PA school. Initially, I had some doubts. I was like, okay, I'm a political scientist. I should not be dabbling with healthcare in any form of way. But when I got into the program, again, another reason that I love the UC Davis program, the faculty, they were so helpful, and they know that, and I feel like they do it deliberately to bring in students that come from a diverse background. They do such a great job once you start us all off on the same level. And they provide us with resources to make sure that if we need that additional assistance with any of our classes, that we do get it. So far in here, the faculty have been so helpful in the sense that even though I was a political science major, there's never been a point where I felt like I did not feel belong. In addition to that, my fellow cohort, they've been also very helpful. We have people that come in with a lot of background, whether it be major or previous work experiences, and we all bounce ideas off each other. I could talk a little bit about how to navigate the government system to ensure that patients are getting the resources that they need to improve their health, and someone could tell me about like what to do to ensure that a patient is getting the nutrition that they need. So as a whole, we learn from one another, and we're able to achieve that ultimate goal of providing the best care for our patients by collaborating as a unit. So if you're indeed interested in the healthcare program, do not feel discouraged or, from any type of setback you may experience or because of the type of major that you're doing. So long as you have a passion for the field and you know the reason why you want to do it, at the end of the day, I strongly believe that you're going to be successful. And thank you again so much for giving this opportunity to be here. I'm able to answer any questions if anybody has anything.
So I had a question. How were you able to relate? I guess maybe the better question would be, when did you know you wanted to be a PA? Did you know from the beginning when you're applying to your undergraduate, or did you know somewhere in between, then you started doing the requirements? And how did you relate that to, if you did, how did you relate that to the PA profession and why that made you want to go that path?
See. For me, actually, my first opportunity to come across the PA profession was actually before college. In high school, I was part of a program called Heart Academy. Again, it's just another program for individuals that are interested in the healthcare profession that are from minority backgrounds. So with that program, I was able to shadow different healthcare professionals, just to give me a sense of what other career options that are there in medicine besides, doctor or, other type of specialties. And that's when I actually got the opportunity to meet my first physician assistant. And just interacting with her, she was very, easygoing, and, she told me a little bit about the profession. You basically get to diagnose, you get to treat, you get to prevent illnesses, and you get to do it in a short amount of time, which is something that I could relate to. That's something that I wanted to do. I wanted to be able to help my community. But being that I'm a first generation student, there's a lot of pressure and being the first child, there's a lot of pressure in the family to be able to have a career within a short period of time and be able to take those family responsibilities. So I was like, okay, you know, I would like to explore the physician assistant program, being that it's a short program. Tuition wise, it's cost effective, and also by, you know, getting to talk to more physician assistants, you know, they're able to have a better family work-life balance, in the sense that you can work in, you know, 9 to 5 and then come home and still be able to spend some time with the family. So looking at all those options, that's what geared me more so towards the physician assistant profession. And as I'm now in the program, I'm getting to learn that it's a profession that it's very easy to transition from one specialty to another. So if, say, you're working in pediatrics and you're like, okay, I'm tired of working with kids. I want to like maybe work, you know, with like the geriatrics population. You could easily do that. The only caveat is that you need to be trained. You need to be trained by a physician. So, and as a PA, we could do almost everything a physician can do. However, a physician would need to supervise us, and a physician, we need to review at least 80% of the work that we do at the end of the year. And as far as supervision, they do not necessarily need to be in the same room. We just need to have an agreement together to be able to do that. So all those factors has just contributed and has just continued to solidify my decision to choose the PA profession.
We have one question in the chat. It says, how did you end up gaining clinical hours in your second cycle? And I'll let you answer that one before I continue on to the next few.
Okay, how did you end up getting clinical hours in your second cycle? So total, the program, is the person asking more so like the clinical hours at the PA school, or the clinical hours that I'm doing right now for PA school? Just a little bit of clarification. I'm talking about clinical hours before. If not, please feel free to clarify. Oh, there we go. Okay, so how I ended up doing that was I worked as a certified nurse assistant. So I started in my freshman year, and I worked part-time while I was in college. And by the time I was a fourth year, I'd already gained about 1,300, 1,400 hours. And the minimum that they're asking for clinical hours is for like 1,000. So I already surpassed that by the time I was a fourth year in college. What I ended up doing during my gap year, it was totally unrelated to anything clinical. It was mostly public health. So I didn't do anything as far as having more additional clinical hours by second round. I just kept what I had, and then got a different experience to give me a little bit of an advantage compared to someone who just did clinical hours and not had the opportunity to actually work with the communities that they're going to be serving, and get to like actually understand those social determinants of health, the health disparities that contribute so much more to a person's health than just the disease processes.
And the second part of the question was, did you mainly focus on grades and the public health experience?
So I'm assuming, again, that's as far as for the application. I did, yes, for my application, I focused on my public health experience, because again, that is something that not a lot of people were coming in with. So I was able to, you know, gain that experience and be able to like portray it during the application. And so yeah, during my during my gap year, that's mostly what I focus on. I think that's what the question is asking. That's mostly what I focus on, building my grades, making them better, and then getting an extra additional experience that's not clinical related. That's different than what other people necessarily have done.
And I thought this was a really good question that now jumping on to more of general, unless someone has more specific questions, you could type them in, or feel free to unmute yourself as well and outright say it. But I know Alexis answered this one already, but I think it'd be a great one for Adan and Mohamed to answer as well. So did your non-science background make the transition to medicine harder, since other science students may have classes that may have had some background in medical classes?
For me, I wouldn't say it made it harder because I took about a year and a half of post-bac classes. So after graduating and then studying for the MCAT, there's a lot of like the pre-med requirements that everyone takes. So it was kind of like fresh in my mind after studying for the MCAT. So in terms of like the first semester or like the first block of study or medical school, it wasn't too bad of a transition. And it's just the amount of material that you get confronted within medical school that it's like, it's not hard material, it's just a lot of material that you need to remember and retain. So the transition wasn't too bad for coming from a non-science, because I did take a lot of post-bac courses, and then studying for the MCAT I felt like was just enough.
Just want to add a little bit onto that. For me, definitely, yes. I felt like, just like how Alexis had mentioned earlier, I felt it was a little bit harder because my background was in politics. I remember like the first lecture that we had in PA school, what we basically covered in general biology in 3 months was covered in a day. And and I was like, oh, okay, I'm not ready for this. So I went back to the drawing board, and I just decided, how can I utilize my hours? How can I become more efficient? And how can I refine my study practices so that it would not be too much of a challenge going down the road? So yes, initially I felt very overwhelmed that there's a whole lot more background reading that I need to do. That were biology majors and science majors, they would like get concepts like this. For me, it did take me some time. But again, you know, I'm so grateful that I was able, the faculty provided me with the resources that I needed, so that come my second, not even my second year, 6 months into the program, that, you know, I'm on the same level as my classmates. And, you know, just having that political science, you know, background, again, even though I was not as initially as good as, you know, my peers say in like the pathophysiology and all that, when it came to like political discussions surrounding health, I was the one that they were looking for, you know, to listen to my opinions, because I had worked with underserved communities. You know, I've worked with, you know, city government, you know, deciding how to relocate resources and how to pass policies to make sure that more patients get more access. So whenever we had those discussions in class, you know, I was there to provide that knowledge, that background, which I think, you know, at the end of the day made us all, you know, good contributors to the program.
Another question that each of you can answer. What was the most difficult part of your paths? Also, what was the most rewarding?
I think I can answer first. The most difficult thing, I think, for me was feeling like I was enough for medical school, like feeling like I was actually like a good applicant that deserved to be in medical school, and that the reasons I wanted to go to medical school were valid. getting over that mental block that a lot of times people describe this as like imposter syndrome, right? Getting over that, I think in undergrad was probably the worst of it, right? I was really fortunate in that I had a lot of mentors. Being involved with Mi Mentor, being involved with Chicanos for Community Medicine, that all really surrounded me with people who were like me, who, you know, had gone through medicine with similar passions for serving medically underserved communities, and you know, they were physicians, right? So by that logic, like, it must be a valid reason to go into medicine. I should be enough, right? Like, getting over that, I think, was probably the hardest. In terms of the application process, that's also the hardest part, is like this constant feeling of doubt throughout the application process of like, am I going to get in? Am I, you know, is my application going to be looked at admissions and just like thrown away because I'm not good enough? Like, that's kind of all the stuff that eats away at you throughout the application process. And I think finding mentors who support you and who tell you that you're enough and that you're a good applicant is really important, because it's really hard to know where you stand when you're going through the application process. That was the worst part. The second part of the question was, what's the best part, the most rewarding part? I mean, being here and getting to see patients, right? Like, easily the best part of this whole process. I have, you know, I may have struggled quite a bit during my first 2 years to get through the science classes, but most of my patients really like me, right? And especially the ones who speak Spanish, like they just really open up and connect with you, I think, in a way that they won't to other medical students who don't speak Spanish, or to other physicians who don't speak Spanish, right? There's more than a few examples during my clinical rotations in which I was the only one on my team who spoke Spanish, and the patient and kind of trusted me the most and wanted to hear things from me. And I think that's the most rewarding part, is finally getting to the point where you get to see patients and you know, reinforce the reasons why you're going into medicine.
For me, the most difficult part on my path was, I want to speak a little bit more on the MCAT. That was a huge hurdle for me to go over. I had to take the MCAT twice, but unfortunately, I had the same score. But in terms of like, there were two aspects that I was really proud of. Like, I scored higher in the biology and the CAR section, and those were the two areas that I really wanted to improve on. That day, I don't know what happened with Chem Phys and Psych Soc. I didn't do as well, but it all balanced out in the end. But for me, and similar to Alexis, it was just finding that confidence and finding that voice, and feeling like if you were enough in order to be in medical school. And but fortunately, my school saw past the MCAT. Like, just find those organizations, find those schools that look past your flaws and see who you are as a person. And I feel like that's like the most rewarding part, like similar to Alexis. Like, each day, every Tuesday, I go to clinics in San Isidro, and it's like the day that I'm looking forward to. And just to being with patients, learning from my two preceptors who speak Spanish, and seeing and learning the tips that they give to me and impart on me is just amazing. And then for the providers and physicians that don't speak Spanish, like this past Tuesday, I was able to help interpret for one of the providers in the room, just to make sure that they were addressing all the needs in order to fill out a paperwork for the patient that needed it that same day. So being that helpful and being that resource, like, had I not been there, who knows what would have happened. They would have took a lot longer to get that paperwork turned in, and anything with the government takes forever in order to get approved. So like, that small impact that I'm able to make as a Spanish speaking person, it has huge implications for the community that you're going to be serving.
Yeah, just want to add a little bit to what Alexis and Dan had said. For me, definitely the most difficult part was just trying to gain confidence, not only in myself, but also confidence from my family to have faith in me. Being a first generation student, my parents did understood the value of education, But to them, they just could not figure out why I want to do 4 years of university in the first place, and then do another 2-3 years of, like 4 or more of graduate school when I could just walk out of high school and start supporting the family like I'm supposed to. So for me, the most difficult part was just having that support from my family. Down the road, they were able to get there and they were able to understand the bigger picture that, okay, what I had in mind, and later that support came, but initially it was very difficult. The second part that I thought was very difficult was just getting rejected by 13 schools with no interview. I'm like, okay, so what am I doing wrong here? Like, maybe medicine is not for me. Maybe I should just stick with politics. I'm comfortable, where I'm right now. I love what I'm doing in public health currently. Maybe I should just continue in this path. Maybe this is the path for me. But it took a lot of courage to not be too comfortable and say, as much as I love this profession, and definitely I would love to learn more about it down the road, I want to give medicine a try again. And I'm glad that I was able to do that, because, just like how Don and, Alexis had just said, now that I'm where I am, the reward is tremendous. Just having that opportunity, even in the student-run clinics, to have people that are coming in with no insurance, people who previously did not have any access to healthcare, what I think is the most basics of services that every human being should be able to have access to. Just being there to be part of that process, to provide them with care and see the happiness and the joy that they exude from being well, and just be well to the point where they're able to, maybe as a result of that wellness, do more so for society in a way that I single-handedly could not do by myself. Just knowing that brings me joy every day, and it motivates me, and it propels me to even get past some of the challenges that I've experienced as a first-year PA student that I'm still experiencing. Just having that in mind, that reward in mind, definitely continues to propel me forward. And definitely healthcare as a whole is a very rewarding field.
And we have one last question for Alexis. Are you worried you will forget basic sciences and clinical experiences in your time off?
Oh, absolutely. I'm less concerned about forgetting the basic science stuff, because once you're past step 1, it's really not that important. The clinical experience stuff, yeah, I'm really worried about it, actually. I think I haven't started yet, so maybe I should try to make a habit of it. But there's like these cases that you can do online that kind of run through kind of a concept, like a basic concept that you should know, or it's like an interesting case that incorporates a couple different concepts. I'm gonna try to run through those at least like once a week or something. So when I come back from my MPH, I'm not completely lost. But yeah, most people say that it's okay, but some people have said like, yeah, no, you're gonna come back and you're gonna be super lost. So I'm a little worried about it, yeah.
And then I see someone asking more about my school. So the full name of my school is A.T. Still University School of Osteopathic Medicine in Arizona. So what are the things that I can highlight is, I'll repeat it again, is that they do send you to different community health centers spanning from Hawaii to Brooklyn for your last 3 years of medical school. And there's actually now going to be 3 different sites in California. So the original one is in Visalia. So it's more farm working in the Central Valley near Fresno. And then the newest one that I'm part of, the first cohort, is in San Isidro. So it's more of the border town. And then the newest one is going to be in Santa Maria, south of San Luis Obispo. So that's another like farm working area too. There's a couple in Arizona, in Flagstaff, Phoenix, and in Tucson. And the other West Coast is in Oregon, Washington, and Hawaii. So if you're interested in going to Hawaii for medical school, you could do that. And what our school really focuses on is addressing the needs of the underserved. And also what's nice, I could kind of talk about burnout. What my school does a really good job is we do mindfulness and wellness exercises. So whenever we meet for small groups once a week in our here CHC at San Isidro, each of us as students take a turn and do like a wellness activity. So this last day that we did on Thursday, we did a little Tai Chi session just to just do that wellness activity. And then when I did when I led it, I did a Zumba session with Shakira's song. So that was really fun to get the blood moving before we did our clinical cases.
Yeah, and we can have Alexis and Mohamed take a jab at the question too. How do you guys combat burnout, especially as a non-science major? It can be a long process.
I can maybe start off with that. For me, what I usually do is, again, just go back to things that you're passionate about and that you love. Hobbies that you may have. I enjoy reading about political theories and all that. So I read a lot, whenever I feel like, I've studied the sciences too much and, my brain is a little bit tired. I read a lot of political theory books. I also like to be in the outdoors, whether it be go hiking or, playing soccer or reconnecting with family and friends whenever time permits. So I think, yes, there could be burnout, pursuing, the healthcare. But at the end of the day, I think it's very important to, find hobbies and, do activities that may not be healthcare related, to keep you motivated, to keep you going. Or it could be healthcare related, whatever that passion is, just keep you going. And again, just remember why you're doing it in the first place. So as you have that in mind, I feel like even if you might be burned out, you'll be able to like struggle through it.
Yeah, I think this issue of burnout is becoming really important and talked about more, especially as there's been more instances of like physician suicide and provider suicide. That's been an issue at my own school actually. So I don't know if I have the answer for you. I think it's really important to have a hobby that you have outside of medical school. It's important to have friends who are not in medical school who you can talk to about normal things. I have some friends from undergrad who we talk about video games, we talk about movies, we talk about anything other than medicine. And when I try to, they're just like, we don't know what you're saying, so stop, which is really nice. I like to do things that just like turn my brain off. So like I said, video games is kind of nice. It helps you escape. Trash TV, I've been watching a lot of, just trying to, at this point, it's like just trying to escape the reality that we're living in right now, especially kind of in the loom or in the cusp of this presidential election, which is going to likely be a shit show. Oh shoot, this is being recorded, sorry. Likely to be, turbulent at best. It's hard to not feel overwhelmed. So after this, I'm going to watch Married at First Sight with my partner, which is important, I think, for us. Just to like kind of try to feel normal for a little bit. I think, unfortunately, it's at least for programs that have like residency after medical school, like a residency seems like it's going to be where most of the burnout occurs, and I don't know exactly how I'm going to deal with it. So I don't know. We'll see. But it's important, I think, to try to keep sane. So I hope you all are trying to keep sane in some ways.
Yeah, just to add a little bit more, it's just make sure your mental health is just as important as your physical health, because the tools and the resources that you bring into medical school, it can manifest different in different ways in your program. So make sure that you have the resources that you can and address those early on so that you can have these coping mechanisms throughout your training, throughout medical school, in your residency, and to make a habit of them, so that, because there's always going to be the next exam, there's always going to be an MCAT, there's always going to be the step or some sort of certification. So make sure that you start drawing lines and make time for yourself, because if you can't serve others when you're feeling burnt out, it might lead to other things and repercussions down the line. So make sure that you're addressing yourself first.